Hello and welcome to the NTI PodTalk. My name is Diane Kaler and I'm Director of Nutrition Therapy Institute. Join me as I talk to interesting people in the field of health and wellness, food and farming, and anywhere else we find conversations that matter to our community. By listening, you'll learn a little about NTI and a lot about the things and people around you that make a difference for your wellness. Welcome and let's get started. Hello, everyone. Welcome back to another edition of the NTI PodTalk. This is Diane Kaler, Director of Nutrition Therapy Institute. And I'm here today talking to Kari Cao, who is a woman with many talents. But Kari is, the way I know Kari is that she's a graduate of our now no longer available NFC chef program, but she has many things going on that I think are very interesting and would be interesting to our community to hear about. So Kari, thank you so much for being here. And I'm excited to have this conversation with you.
Thank you. Yeah, I'm glad to be here too.
Yeah. All right. So I want to start by talking about your sort of before you came to NTI and what you were doing with your life before you came to NTI. And we don't need to go all the way back into your childhood, but you are a physician associate, excuse me. And so you have training, in the medical field, you're a licensed medical professional. And so if you could talk about that and a little bit of your background in your training and what drew you to want to do that kind of training and how that showed up in your life prior to coming to NTI, and then we'll move into what brought you to NTI.
Sure. So I've been a PA since 2010. My training was pretty standard for a PA, so it was 27 months straight through, really no breaks at all, and lots of clinical time. So really only a year of didactic in the classroom, and then the rest working right in the clinic, and lots of different subspecialties as well as internships with professionals. So a good way to think about PA school is kind of an accelerated version of medical school, where you really focus on getting into the clinic as soon as possible and really getting your hands dirty, so to speak. And just like my counterparts, nurse practitioners and medical doctors and DOs, I got very little training in nutrition. I got 3 hours. Most providers get less than 10. And yet patients see us as supposed to be experts in nutrition. And ironically, my thesis in graduate school was creating a nutrition curriculum for clinicians. And what I discovered in my practice is with 15 minutes and 1,200 patients, it's impossible to stay on time. And I found that I either had to stay on time and just tell patients, eat healthy and exercise and give them a pill, or I could really dive into explaining things and explaining how medication works and talking to them about nutrition just from my own knowledge base. And honestly, after getting burnt out in clinic and realizing that we really only see a fraction of a patient's life, I started doing home visits through the same practice. So I was working mostly with uninsured, underinsured, primarily Spanish-speaking population at Clinica Family Health in Thornton. And then doing the home visits was an incredible opportunity for me as a provider to really see not only what we're missing, but more importantly, all of the assumptions that we're making in the office that are very important to realize are not necessarily true. So, for instance, going into patients' homes and talking to them about, eating healthy, and then realizing they don't live anywhere near healthy food, or talking to them about exercise and then going to their home and seeing that there's nowhere safe that they can go on a walk. So for me, it was a really eye-opening experience that rather than just telling a patient a destination, I really needed to give them a roadmap. And one of the things I loved about the home visits is I had an hour with a patient, and I would go with a case manager, and we would look at psychosocial and medical reasons why patients would be readmitted to the hospital. And that also included moms and new babies and why they weren't set up to thrive. And every patient, you would walk into their home, they'd pull out their medication bags that were, probably like grocery sized bags of medications, and you would go through them and you'd go through everything from the hospital. And my favorite thing was patients would say, you don't need to be doing this. Like, my doctor knows everything I'm taking. And it was an informative experience because you would go through these and you would ask them why they're taking it. And most people don't understand the reason why they're doing things
Right.
and what this medication is, or it's duplicative of something else. So just the dangers that we found in that experience. So fast forward, then COVID hits and I was furloughed, and I had at that time a little guy, Micah. He was under 2, and I decided, rather than potentially putting him at risk, or I actually went back to school to pursue my dream and become a professional chef, really with the focus on cooking to optimize our health. And that was kind of what led me to NTI, and I'm happy to explain more in a little bit.
Yeah. Well, what I really like about what you just said is that rather than looking at someone and seeing what their end result, the end result you'd like them to be able to achieve, you needed to give them the roadmap to do that. And, I'm sure there was a lot of medical advice that went into that roadmap, but now let's bring in the cooking, because cooking for yourself is one of the most important things that you can do to optimize your health. And so being able to cook is a big part of that roadmap of achieving your end goals. So talk about, why did you want to pursue chef training? And maybe expand on how that fits into the roadmap that you were trying to create for your patients. And then talk about what made you choose NTI.
Sure. So for me, the cooking really is, I think, the biggest challenge for everybody, honestly. And you're told to eat healthy, but you what to do, but you don't actually know how to do it. So for instance, I remember one of the things you had mentioned, because before NTI, my husband was wanting to be vegan, and I thought I would show up to NTI and you guys would preach veganism, and it was and so that's kind of like the things that you think about, and then learning through the courses, not just as a chef, but also taking the nutrition components with it, that you have to soak your food, and you have to do all of these different things to ensure ultimately that you're actually getting the true nutrition from like the nuts, or from the different ingredients, ultimately, to actually be able to absorb it. And I thought it was interesting too, with like spinach and like eating, just different things you didn't realize, that when you're eating it, you're like, oh, my body's not actually optimally using this. So for me, the cooking part was really my own curiosity and my love of creativity and cooking, and something that has led me to then think, okay, I'm not the only person that would benefit from this. So, and I can tell you more about our company, but how it initially started was thinking about, could we maybe create like food boxes or something for patients, and then giving them like prescriptive meals. And then that ended up actually transforming into creating a digital interface. So a patient app, a medical provider dashboard, and then a tech-enabled lifestyle and nutrition coaching program that's using a patient's own personal biometrics. So right now, focusing on their glucose levels through a continuous glucose monitor, and tracking what are the trends, and then more importantly, what are the triggers, through logging their macronutrients and their nutrition through an AI app through our phone, and then being able to detect what could be better. The step then beyond that I'm excited bringing in the culinary part, which is something that we'll be bringing in the future, is then actually teaching them, how do you create these meals? Because we're giving them right now a lot of the tools to create them themselves, and the step by step, but then actually bringing in cooking classes and ways, creating a community around that is really my dream. And showing that you don't actually have to have knife skills. You can use a chopper, it's more about let's teach you how to assemble things and make it
Mhm.
so cooking isn't so complicated.
Mhm. Yeah, complicated, potentially overwhelming,
Yeah.
feeling like there's, long lists of ingredients that feels overwhelming.
Yeah.
And so to develop that level of comfort, and also when you cook for yourself, you have control
Yes.
over what goes
Yes.
in the end product. And I
Exactly.
think that's one of the most important benefits of learning how to cook. And it doesn't have to be complicated. It doesn't have to be, like, you know, I don't know. I always think of Julia Child. I don't know why, but it doesn't have to be that complicated and, French recipes and all that kind of stuff. There are very simple ways to prepare your own foods so that
Mhm.
you have control, so that you're taking responsibility
Yes.
for yourself.
And
And all those things are.
one of the reasons too I wanted to go to school was as a busy mom. I have two kiddos, Maddox and Micah, and trying to figure out ultimately how do you take various ingredients and then prepare it for the meal. And that was kind of my goal from the beginning of culinary school was like, how do you actually batch cook and prepare nutritious foods that doesn't feel like a leftover, but rather you're repurposing something.
Mhm,
And that's something that eventually will be, bringing into the platform too, of how do you take, ingredients, cut them the same way, and then you can use them in various recipes without being overwhelmed with having to prep everything.
mhm. Yes, yes, because the prep is also a big part that can be overwhelming to people. All right. So you've talked, you've sort of opened the door and introduced what you're doing now. So you're a PA, and not but and you also have created this company that RenewRx, correct? That's the
Yep.
name of it. Yes. So you're the founder of RenewRx, which you started to give kind of some background or some details of what RenewRx is. But can you go back
Sure.
and kind of give us a very basic understanding of RenewRx, and then we'll kind of get into the details.
Yeah. So something important to note is when someone gets pregnant, the first thing they get when they go for establishing care is a prescription for a prenatal vitamin. And then they get a list of all of the things that they should not eat and what they should not do. And there's never the instructions of, well, here's actually how you can optimize your health. Here's what you can do to prevent, instead of talking about like folic acid, like let's talk about how do you actually naturally eat a lot of folate. And that's never brought up. They don't talk about, increasing your leafy greens, things of that nature. And for me, it's more a time where it's so disempowering that really giving women an opportunity to say, like, I own this, I can do this, was really what drove us. So we're specifically working to support patients in pregnancy by integrating directly with the medical office. And if you think about it, in pregnancy, there's really three things primarily that are under control. One is the prenatal care, two is lifestyle, and three is nutrition. Yet lifestyle and nutrition are truly absent from prenatal care. So our goal is bringing that in to the office and having it be an extension of the service the medical office can offer their patients. And it's fully covered by insurance. It actually brings additional revenue to the practice in a monthly recurring fashion. So for me, the reason why we started with patients with gestational diabetes was my sister, when she was diagnosed with this condition, it was an abrupt shock to her when she called me, and it was her, she's the person that's like one of the strongest people that I know, that you call her for anything and she's always got the answer, or figure out a way to do it. And suddenly she's calling me desperate and alone and just overwhelmed because now she suddenly overnight has to change her nutrition. She has to poke her finger 4 times a day to check her glucose, which she doesn't really know much about what that means. And then now she's got twice the number of doctor's appointments. And having been a person that cares for these patients myself, I didn't actually have a tool to give her to say, here's how you make these changes. And I didn't have the roadmap. And so for me, that was really an opportunity where I said, okay, this is truly a population that wants the support and the medical providers want to offer it. And that's where we really could fit in and support both the customer, who's the medical office, and the end users, who are the patient and the medical office.
Great. Okay. So RenewRx, you're focusing on pregnant women, particularly women who have gestational diabetes, correct?
Yes,
Okay.
gestational type 2 and soon to be type 1 as well.
Okay.
Yes. And then we'll be able, our goal ultimately is expanding beyond just diabetes, because if you look at all of the different elements of prenatal care, nutrition and lifestyle span everything. So it's like a $30 billion maternal health market looking at pregnancy itself. And then you look at the periods surrounding that time. So prenatal, pre-pregnancy, so fertility, and then postpartum, and kind of looking at the life cycle surrounding that period of time and also how nutrition adjusts accordingly.
Okay. All right. Well, I agree that this is a population that needs a lot of support. Um, you know, and gestational diabetes, I think there is some um, preliminary things that are going on for the woman before she gets pregnant that could, result in them getting a diagnosis of gestational diabetes. So having this knowledge for the general population is really helpful, but this is definitely a niche area, a targeted area of patient care where I think there is a lot of lacking information. So it's great what you're doing. So talk about what RenewRx is, like what actually is it? You mentioned something about AI and I think you said the word app. So
Yeah.
put it together and what actually is the tool that you're using?
Yeah, so we launched last year with a paid pilot with the largest high-risk OB group in the country, starting at four local offices in Denver, and did that until January, and then now are the standard of care for their practice. So prior to us coming in, patients would get diagnosed by their general OB and then referred to their practice. Typically, patients get diagnosed with this condition around 24 to 28 weeks. They do it by drinking a glucose drink that then ultimately shows at initially like 1 hour what their glucose level is, and then they repeat it again, and it's fasting 1 hour, 2 hour, 3 hour, fasting. No, 3 hours. Sorry, fasting 1, 2, 3 hours, and then looking to see what the results are and how does their body ultimately absorb glucose. And that test itself is flawed, which I could get into for a long time. But ultimately, they then suddenly get this diagnosis. And then by the time they actually get into the office, they're now maybe closer to 28, 30 weeks. And there's maybe not an appointment for 1 to 2 weeks to see their practitioner. So these women, their heads are spinning. They're just, going on Reddit. There are all these things that like suddenly it's just this heightened anxiety.
Right.
And
Well, can I pause you? Talk about what are the risks of gestational diabetes and why is this such a big deal?
So the risks of gestational diabetes, it depends obviously on the level of severity. There's, a stillbirth, which is very now, luckily with insulin and treatments, low risk. There's the risk of macrosomia, which is like a big baby that ends up having to be, a C-section, or if the baby's delivered, there can be a shoulder dystocia, which is like the shoulder gets stuck, and then it could lead to like a palsy where the arm doesn't move like it should. That's actually, my husband's a pediatric orthopedist where he does upper extremity. So he's, repaired some of those before. And then also when mom is on insulin or her glucose isn't well controlled, especially at the beginning or at the end, baby then can end up in the NICU because their glucose is also not controlled. When baby's born, suddenly they don't have a glucose source, but they have all this insulin, high levels of insulin in their body. So then they become hypoglycemic, low glucose, and that can be really dangerous. There's also higher risks of like preeclampsia, which then can lead to eclampsia, which is seizures. And then, women in the US now, the risk of death from lots of different complications of pregnancy is only getting higher than especially compared to other developed nations. So I always say that like in the US, being pregnant is actually more dangerous than being a police officer in the line of duty. And it's a time that when you're able to optimize your health, you can actually, prevent a lot of these complications from occurring. There's a lot of research that shows that. But there's not something that shows specifically with, like a correlation between diabetes and really poor outcomes, but it's definitely a big risk factor for then this progression. And that's why we really see that in lifestyle nutrition as the key.
Okay. All right. So I interrupted you. You were talking about kind of the traumatic experience of getting a diagnosis and not knowing what to do with it.
Yeah. So the current way is just basically women, their minds are spinning. They don't actually get the medical appointment until several weeks after the diagnosis. They've already had, 30 weeks of this high glucose levels that the baby's just bathing in, which then causes also lots of risks of, pediatric obesity, also causes complications for baby. There's been studies that show now a correlation between like neurodivergence, autism, ADHD, and maternal diabetes and pregnancy. So there's a lot of research that's starting to show that bathing in these high glucose levels as a baby is not healthy. So mom really has such a little time to be able to make a change once she has this diagnosis. And when they get referred to an office that's actually working with RenewRx, how it works is as soon as they get the call for the receptionist, they get 2 appointments. They get one with the RenewRx that same day, and we get them onboarded to our app. We do a warm welcome call with them and just making them feel heard and seen, that there's someone in their corner, that their office really cares about them and they want to provide these services. And they suddenly feel like they have something to do and feeling in control, because for the next couple of days, we have them do a no filter food journal, which is basically take a photo of what you're eating. We don't care what it is. Like, let's just learn what you're currently doing. And then wearing a glucose monitor, and let's just see how your body's responding. Like, let's not change anything. Let's just see how you're naturally living and what your body's doing. And then they go through a nutrition course, which we call the Renewed Plate series, which is like a 20-minute edutainment module about just nutrition 101 and how do you renew a plate. And then they meet with their coach and they take those same concepts that they learned and they now apply them to reviewing the food journal that they just had and the glucose results, and then saying, okay, how do I level this up? How do I take this from being a red plate to a yellow plate, or a yellow plate to a green plate? Not how can I like start from scratch of here's how I build something, but rather here's what I'm currently doing. How do I renew it? And that's like the main concept that we're really aiming at. And then they get put on their one thing pathway, which is you focus on one behavior, one thing each week. And that's ultimately then what leads to lifelong changes. So typically it's starting with their renewed plate, their one thing, renew my plate. And the idea is really starting with one quadrant each week and then adding to it. So they have kind of a more intentional experience around quality carbohydrates. Then they have a week about like, how do you do quality proteins and making sure you're getting enough protein? And then how do you do veggies and making sure that you're getting enough fibrous veggies and a variety? And how do you make veggies delicious? So all of this education that's really supplementing what they're actually doing. And then, so by the time that they've seen the coach and they've gone through this program, they already have a very basic understanding of what they're supposed to be doing to feel in control. That way, that first visit the medical provider is seeing them for, which is, now at week 1 or 2 of this diagnosis, they've already gone through some education on nutrition. They already feel like they have a pathway to follow so that they can understand how to succeed. And then the medical provider can really focus on the medical treatment and how to keep mom and baby safe and not having to worry about teaching them nutrition, but rather checking for comprehension. So I think it allows the medical provider to really focus on where they have been trained and where they're experts and making them feel comfortable because we have a collaborative relationship with their office that they can see what the coach is actually doing for these patients.
Nice.
And so we're not living in separate silos where the patient's referred out. We work in tandem.
That's great. So are they getting so they're getting sort of lists of food, and are they getting recipes? Are they getting, you mentioned cooking classes, so they're not getting like hands-on cooking classes, but what resources are they getting to actually implement the guidance that they're getting?
So they work with a coach, and they get insurance covers 2.5 hours of coaching per month, which is direct and indirect. So meaning the time it would take a coach, for instance, to put together a meal plan or something of that nature. But we have lots of curriculum we've already created. So when something comes up, then we know, okay, would be really supportive for that patient. And then same thing for like if we're noticing this patient is having challenges with snacks, putting them on a snacking pathway, then really focusing on, education on how do you build a snack box or how do you do this. But the idea is looking at their data and seeing if you're noticing trends that are starting to go the wrong way, reaching out then and helping the patient rather than waiting until something is too late.
Great.
And then in the future doing, would love to do cooking lessons and things of that nature too.
Right. Yeah. Yeah. Because, I always come back to the hands-on, like it's really hard for someone to, like, you can tell someone, here's what you should do,
Yeah.
or, here's what it should look like, and, here's a recipe, but
Yeah.
until they're
Good luck.
actually like led through
Yeah.
it step
Yeah.
by step, I think it's
Yeah.
hard for them to actually visualize doing it themselves.
Yes. That's why like we focus on recipes with like 5 ingredients or less
Yes.
and making it where it's really just focusing on one thing. So it's literally for that first week, it's how do you actually choose high quality carbohydrates? And what is a carbohydrate? How do you read a food label? Like things that are just making it so that they're really easy and actionable instead of giving a patient like we intentionally don't do like meal plans because we don't want it to feel overwhelming where they get a whole bunch of recipes. But if a patient's specifically asking for something where they're saying, I really could use support with like how choices for dinner, giving them things like that is definitely helpful.
Yeah. Um, I think that's just, great. It's always going to be good to provide them with those resources and ideas, and because a lot of times people get stuck maybe in habit,
Hmm.
how they were raised, you know, thinking that there's only one path towards accessing food, getting food, eating food. And so to get all of those ideas from sort of an outside perspective helps, I think,
Yes.
expand
Yes.
their vision of what's actually possible.
No, I agree. I think
Yeah.
the idea is really to empower these women because up to
Yeah.
7 out of 10 of women that diagnosed with gestational diabetes within the next 5 to 10 years will go on to develop type 2 diabetes
Yeah. Themselves. Yeah. Yeah.
themselves. So really helping create a habit and not just a temporary change because how it works now is it's more restrictive. They come in with a food log and their glucose numbers a week after they ate the food. And then they're like, oh, looks like your lunches are high. Like, let's talk about what you eat. Okay, well, let's not have rice anymore, or let's cut down the rice. And, you're not seeing actually instant results of, okay, here's what happens when I eat rice. Let me try this suggestion that RenewRx made and see, oh, wow, that really made a difference. So you can see in real time the impact.
Yeah. So they're wearing continuous glucose monitors.
Yes.
Yeah. Yeah. All right. So you have your RenewRx has been implemented in several, sounds like doctor's offices. Can you talk about um, case study examples of how your work is really helping to support women?
We actually have a podcast that we're starting. So we have several women that will be on there, having been featured just through their journey. There's one patient specifically, Rachel, that she came to us when she was 8 weeks pregnant, and my co-founder Kelly describes her as like a 11 out of 10 on the anxiety scale and overwhelm, and
Uh-huh. Uh-huh.
just going on rate, kind of basically kind of what I was describing. And now she's completely like, she feels so in control. She's, just quickly looking at her plate, she can identify, okay, here's where I could use some improvement. Or you know what, like this is fine. Like it's a red plate. I'm going to enjoy it. I remember listening to you once about saying like, you don't call it a guilty habit. You just like, or, like, what's your guilty pleasure? You're like, I just like enjoy it. If I'm going to eat something I don't like, I'm going to just eat it, or not don't like, but it's not good for me. Like I'm gonna just eat it and enjoy it and not feel like have to feel guilty. And
Mm-hmm.
that really stuck with me, of the idea of like just giving people permission to live. And
Mm-hmm.
I think that's what really gave Rachel the confidence to go into the journey from, being kind of caring for yourself to now having a whole new person that you're responsible for, and feeling really in control, because it's a very isolating experience and an out of control experience for all of us.
Mm-hmm. Yeah. I think that oftentimes things that happen in a woman's life, um, particularly starting with pregnancy and then also having to do with, after reproduction ends with perimenopause and menopause, all of that gets very medicalized.
Hmm.
And I think women are entrained to believe that the things that happen to them because of nature and the way that our bodies are created require or are medical experiences.
Hmm.
And so I love the fact that, yes, there can be complications that are medical, based
Yeah.
in pregnancy and other stages of life. But I love how are talking about empowering women to take control and not feel so, um, so sort of like this is a whole medical thing and they don't have any, it's all like whatever the doctor says, just doctor do, doctor, fix, 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 fix. Coming from the outside, I think it's so important that they feel like they have control. They have,
Yeah.
but really the only way to do that is to be empowered by knowledge.
Hmm.
Um, and you're providing them with that knowledge. And I think
Yeah.
that's
And
great.
I think that the part that makes them trust us is because they know that we're working alongside their medical provider, that they
Hmm.
feel a sense of like, okay, I'm not, because a lot of people get scared when they're starting to do things that maybe aren't necessarily in the realm of the medical world, and they're starting to look at food as medicine. And I think that the offices, by us being an extension of the services they provide, really make it so that these patients feel like, okay, I can actually really prioritize my nutrition, because that's what my provider is aware that I'm doing that, and it's okay, and I can see actually it's really improving my health.
Hmm.
But
Great.
it's unfortunate that, at least now, that nutrition isn't prioritized in our training or in what we can promote, but it's becoming something that's much more of a forefront. Like Prime Health is hosting a Food as Medicine Summit. There's next year the AAPA, the Annual Academy of Physician Associates, is doing a whole Food as Medicine core. Like, so it's becoming more mainstream, and
Hmm.
there's culinary medicine courses and things like that. So at least it's becoming, I think it's like we're on kind of the precipice of something big.
Hmm. Nice. That's awesome. Um, all right. Let's see here. I also wanted to ask you about you have won at least one award that I know of and are maybe in the running for another one. Talk about that because I think that's really just speaks to the uh, you know uh, uh, the acceptance and the acknowledgement of the need for your program.
So it's so funny. I actually haven't been there's like all these things, all these opportunities keep ending up in my lap, which is incredible. So I was outreached by Regis College and they were hosting a innovation challenge, which was an accelerator program. A good way to think of it is kind of getting mentorship and extra trainings for entrepreneurs. And I remember I had a lot of stress at the time when I was applying, and then I had to go for a pitch competition to even get in. And I remember I like completely botched the initial pitch. And so I was like, oh, I definitely didn't get into this thing. And just kind of a lot of stuff happening. And I was like, that's okay. Like fail forward. I'll try again in the future. And then I get an email that I got in, and then ultimately it finished with 5 teams in the finals, and then they chose one to get the grand prize, which was that recognition, and then $10,000, which was quite a nice prize for a startup business.
Yeah,
I was
that's
also in
nice.
a hyper accelerator program through Rocky's Venture Club, and we're a startup to Scout, which they're kind of continuing to follow our progress and interested in investing. We're a finalist for MedTech Innovator, which is out of 1,400 companies worldwide. We are in the top 200 and will be hopefully making it to the final cohort of 65 that they choose in June. But that's basically that's an incredible opportunity, and it's sponsored by lots of different Dexcom, different companies in the space. And the goal is to make your company as investable and as scalable as possible, and as successful as possible, and partnering you with a industry leader to really help you bring your mission to a much larger scale. Um,
Hmm.
but yeah, there's just been lots of incredible opportunities that have come. And it's funny, I didn't think that I would be, a CEO or in technology. I thought I would be the person in creating the recipes, and the person doing the medical, all of the medical stuff. And then when I got out of school, I was going to be partnering with one of my friends, and his life circumstances changed, and ultimately it was either me taking over the company and leading the direction and becoming the CEO, or kind of giving up on this dream. And I ended up taking the bull by the horns and really pursuing it, and I've never looked back.
Nice. Nice. Great. Well, that's, congratulations and all of those awards and opportunities for awards. That's great validation for your company. So that's
Thank
gotta
you.
feel good.
Yeah, thank you. It does for sure.
Yeah. Nice. All right. Well, is there anything else you wanted to talk about that I haven't asked you? Anything you want to add?
I'm trying to think. I mean, our big thing is we're right now raising capital, so we're raising $1.5 million, and really it's an incredible opportunity because we've proven our concept, we've proven that this model is something that insurance reimburses for. It actually brings significant revenue to an office, especially most prenatal practices. How it works is they're not actually reimbursed until after the delivery. So that means they have like 10 months that they're floating cash for these patients and have no reimbursement for the services they're offering until the end. So for an average practice with 100 deliveries a month, you're looking at nearly $8 million annually that they're floating for providing prenatal care. So we're able to bring them, we've shown in the paid pilot, around up to $1,000 when all codes are met through our services per patient per month. So that is a pretty significant reimbursement and really very minimal cost to the patient out of pocket. So we now are scaling with the largest high risk OB group in the country. And it's kind of, we're at this like moment where there's like the inflection, and the ability for someone to invest right now is just going to lead to exponential growth for us, and then also for them as an investor, not only impactfully, but also financially.
Nice. Good. Well, congratulations. So how can people find out about you? Where do they find you on all of the World Wide Web,
So our website
internet
is
stuff?
RenewRx.health. And then our LinkedIn is, if you look on RenewRx, my LinkedIn is Kari Cao, Karicao. And they can always reach me by email, Kari@renewrx.health, Kari. And yeah, I would love to connect with individuals who are like-minded, looking for, offices to collaborate with, looking for investors, looking for people who just really are excited about following our journey. And yeah,
Great.
I appreciate the opportunity to be on.
Yeah, nice. Well, it was good talking to you, good catching up. I was not clear on everything that you were doing, so it was good to get this, have this discussion so that I understand a little bit more about it. And I'm always proud of our graduates when they leave NTI because they always do amazing things. And this is another one to add to the list of, all the amazing things that our graduates are doing. But, I am very happy for you and your success, and really happy that you are serving, or underserved, group of people that I think really need a lot of support. So that's
Thank
awesome.
you. Yeah,
Yeah.
it's hearing just from the moms, like when it's very touching.
Yeah. All right. Well, and then you said that you're starting a podcast, so I assume they can find the podcast on your website as well.
Yeah, it'll be stories behind the bump. So,
Oh, that's great. That's
so
great.
it'll be from the moms, from the providers, and inspirational experiences all around.
Nice. Wonderful. All right. Well, Kari, thank you so much for your time today. It was really fun talking to you and hearing about your RenewRx progress and where you're headed.
Thank you. It was
Yeah,
great to be here.
thanks.
It's so fun to catch up.
Hi, Diane Kaler here again. If you found this conversation interesting and haven't already become a student at NTI, check us out at ntischool.com. We hope to see you soon.